So I always loved animals and always wanted to help them and take care of them. As I got older, I started to really enjoy the math and sciences, so going into veterinary medicine was a great fit for me. Actually, when I was in vet school is where I started developing my passion for cardiology. I always liked that subject, but actually when I was a student, my family dog ended up having cardiac disease, so it really spiked my interest to kind of go down that path so I can help other people's pets too. So the Zika virus is a virus that's transmitted by mosquitoes, and right now it's mostly in South and Central America. Right now we know that in people, if they get bitten by an infected mosquito, they can get some mild clinical signs, some lethargy, rashes, muscle aches, but usually can recover from it in about a week or two. The big concern is if a pregnant woman gets bit by the Zika virus, and that can have really catastrophic complications for the baby. They can get something called microcephaly, which is when the brain becomes underdeveloped, and that can lead to really bad neurologic complications and sometimes even death. In animals right now, we're still learning a lot about the virus, so we're not sure yet if the virus can affect dogs or cats. Our main recommendations are just to maintain adequate mosquito control, so not having stagnant water around the house or backyard, such as buckets or flower pots. Something we do know, especially with dogs, is they can get something called heartworm disease, and that is transmitted, we know, by mosquitoes, and we can actually help prevent that by giving year-round monthly heartworm preventative. So we always recommend to do that because heartworm disease, we know, can have very serious and life-threatening complications in dogs and sometimes even in cats. What happens is the heartworms tend to live in the pulmonary circulatory system, and these dogs can be affected with hundreds of worms that can actually be as long as 12 inches. So it can really affect their circulatory system and cause complications with clots and anaphylactic reactions. So it's definitely always better to prevent them from getting these kinds of diseases and be proactive about giving the heartworm preventative than trying to help them after they've already had such a serious infection. I really enjoy being a vet and especially being a cardiologist. I love that in my field I get to help treat these dogs with heart disease, both with medical management, and sometimes we can actually have interventional cures and even place things like pacemakers. It's great to work in a hospital that has so many specialists that work so well together, and it's really a team effort on every case.